Letrozole is one of the commonest drugs used for polycystic ovarian syndrome and ovulation induction. Now, let's look at the doses and what studies tell us. The general regime is 5 milligram, two tablets from day 2 to day 6. Now, when it doesn't work, and especially when it doesn't work, what are the alternative regimens that have been tried? And one is looking at 5 milligram dose for 7 days, increasing it by two more days, and ovulation rates was 69.5% in one of the studies. The cumulative ovulation rate rises to 92.75%, followed by a 10-day therapy. Again, remember, these are small studies, but it tells us that sometimes you require a higher dose of letrozole to break the FSH threshold, which means to make follicles grow. And especially you see that in cases of resistant polycystic ovaries. 5 milligram for 10 days induces ovulation in those cases where it didn't work for 5 days in 76.8%, and used after a sequential, again, which means that you've tried this for 7 to 10 days and it's not worked, and then adding it over a longer period may help. Now, if you look at a dose of 7.5 milligram for 5 days, again, use it when all your other regimes have failed, and the pregnancy rate would increase provided in that study you added FSH. It seems to produce more follicles than 5 milligram for 10 days in combined protocols. So, what is it telling us? It's telling us that in PCOS, which are resistant, have high insulin, increasing the dose and adding FSH may be useful. Now, is 7.5 milligram for 10 days? Is there any role? Again, the evidence is very limited, and it's something known as a stair-step protocol where you increase the dose having seen a previous failure, and the ovulation rate reached about 83%. Again, these cases are more of a trial and would require to be seen by a reproductive medicine specialist, because if you're going to extend the dose, you're always also going to risk multiple follicles and the risk of multiple pregnancies. Now, the two-step protocol, again, looking at increasing, and a stair-step protocol seems to work in those cases where your initial treatment doesn't work. So let's say you had 7.5 milligram for 7 days and nothing, there's no follicular growth. You could then, in 10 days' time, see whether you can increase the dose for 10 days. In some cases, it does work.